Hi, I'm Dr. Davis from Baldwin Animal Clinic, and today we're going to talk to you about the canine and feline annual vaccinations. These are the vaccines that your pets need to get boosted yearly. And so to start with our canine vaccines, we'll start with our core vaccinations. First, we have our DA2PL. So this vaccine has distemper and parvo, which it's most commonly known for. It also treats adenovirus, parainfluenza, and leptospirosis. So this vaccine is very important. A lot of our dogs are exposed to parvovirus especially, but also leptospirosis, which is passed in wildlife urine. So very important to get this vaccine yearly. The next vaccine is our Bordetella. This vaccine is one of our kennel cough diseases, and so we want to make sure that we're vaccinated for Bordetella yearly, especially if we're going to the groomer, if we're boarding, but also just to be prepared, because if your animal is going to be hospitalized, you want to have this vaccine before they have to be in the hospital. This is an oral vaccine, so it's not another stick. We do just put this one right in the mouth. Our other core vaccine that is required by law is our rabies vaccination. This one's very important. Wildlife can pass rabies. Even if you have a house pet, you still need to have this vaccine on board legally to protect yourself and your pet. Our two non-core vaccines that we have started using more in the South is our canine influenza vaccine. This is the H3N2 strain of influenza. It was brought over in some rescue dogs from Asia. We've seen it in outbreaks at dog shows. Everybody going to the show got infected, went home, spread it around their communities. And so this one's starting to be more common. If we have not gotten this vaccine previously, it does require a booster. And so this one we're starting to hear more about in the news. And so we do need to be prepared and get our influenza vaccine, especially if we are going in populated areas. Our last one is the Lyme disease vaccine. We don't see it a lot in the South because the ticks are not as bad as they are up north. But this vaccine is very important if you're traveling up north, if you are in a tick area where ticks are very common. We want to get our vaccine for Lyme disease. Our feline vaccines, we just need the two. And so we definitely want to have our rabies vaccination done yearly on our cats as well. We also need the FVRCP. This feline vaccine covers rhinotracheitis, leukemia, calicivirus, panleukopenia, and chlamydia. So this vaccine is very important for our cats. And that's all of our annual vaccinations. And so if you haven't gotten those up to date, let's schedule an appointment and get those done.